Hi guys. As promised, we are going to dive into learning how to critically appraise an article. Um, the basics, this is the basics of critical appraisals, okay? This is an essential step to understanding why we read and review and do studies in the first place. So that's what we're going to talk about. Hopefully you guys can see my screen okay. I didn't know how else to put it to make sure you can see everything. So I'm going to leave it as is. So moving forward, on this journey of EBP, we have done quite a few things already. We have learned to look at patient care and make a decision on what you would like to study, or what's a question that you don't have an answer to but would like more information on. And from there we've learned to formulate a focus question using PICO, making an answerable question. We've also learned to search for the best evidence. This is done through the search strategy assignment and looking at the PubMed assignment as well. And now we are going to learn to appraise the evidence. And this is a key step because this is the final step before applying the evidence. Ooh, doesn't that sound cool? It is cool. All right. So there are a few key points that I would like for you to take from this slideshow lecture. Okay. The first thing is critical appraisal is a systematic process used to identify the strengths and weaknesses of a research article. Okay. Essentially, we want to know if what we're reading is valid, and if it's valid, should we be using it? Okay, critical appraisals provide a basis for decisions on whether to use the results of a study in a clinical practice. Also, know that there are different tools that you can use to help you critically appraise an article. Okay, you've already been introduced to one, um, and you will be introduced to a few more throughout the modules. Okay, so there are 5 elements of a critical appraisal. Those are these questions right here. So number 1 is, what is the research question? What is it that we are really trying to understand? What do we want to know? Secondly is, what is the design of the study? What did they use to conduct this study? How did they make it? Was it RCTs, otherwise known as randomized controlled trials? Was it a cross-sectional study? Was it a cohort study? What was it? Okay. The third thing is the study valid? Is what we look is are the methods valid? Okay, what is the study's validity? Next, we want to look at the results. Well, what do the results tell us? Is the information true or not? What do the graphs say? What does the text say? What do the figures say? And then last but not least, you want to make a decision on whether you can, if the information is valid and you feel that it would be useful, could you apply this to your general population, or is this great for just looking at one patient's case? Okay. Um, So I guess we need to first of all question, why does evidence from research fail to get into practice? Okay, we should know these. We know that research is a lot of work. It's a lot of searching. It's a lot of gathering of data, collection, analyzing the data, trying to make sense of all the information that you've been provided. The problem is that there's a lot of research out there that really isn't great quality. And the problem with that is that you have these studies that weren't designed well, have false information or misleading information, and this leads to drawing false conclusions. Okay? Other reasons are generally, well, people don't understand the statistics. They read the results sections and they see these numbers and they see the p-value, the confidence intervals, and they're like, well, what are they talking about? Another reason is, well, simply some people just do not know how to critically appraise a research paper or an article or a topic. This is why we are taking the time to learn it so that you can apply it and you will understand it. Okay. So, again, why do we need to critically appraise an article? Well, it's an essential step in the process of putting research into practice, okay? You're asking questions about an article's research methodology. You're looking to make sense of everything that you've just read. So you are scrutinizing the data collection and analyzing the methods and evaluating um, if the findings presented will help you to determine whether that the article's conclusion should influence your practical decision making. Okay? So when we critically appraise an article, we generally start with the question. This is the focus question. Okay, and this focus question you will generally find at the end of the introduction or within the background section. So within those first two, there should be an answerable question, also known as we've been working on the PICO question, looking at the patient. It should describe the patient and population, the interventions that they're looking at or exposure. What are they comparing it to? And essentially, what is the outcome that we are trying to get to? Okay? Study design. Now, there are multiple study designs, and I've listed the ones that you will see the most. And these are great to know and understand what they are. So, you have randomized control trials, you have controlled trials, you have cohort studies looking at prospective and retrospective data, you have case control studies, and you have cross-sectional studies. Okay? Well, let's just start from the top. Randomized controlled trials, also known as RCTs, these are carefully planned experiments. Okay? They generally introduce a treatment or an exposure to a study or to essentially study the effect on patients. And they include methodologies that can reduce the potential for bias by using randomization and blinding. And that allows for comparison between the intervention groups and control, which an example of control could be no interventional at all. Okay, so randomized controlled trials are planned experiments and they provide sound evidence of cause and effect. Okay, then you have controlled trials. Controlled trials are very similar to randomized controlled trials, except there's no randomization. They're just controlled. Cohort studies, well, those generally identify a group of patients who may already be taking a particular treatment or already have an exposure. Then they follow those patients and then they compare the outcomes with a similar group that generally has not been affected by the treatment or exposure that they are looking at. Okay, these are observational studies. They are not as reliable as randomized control studies or RCTs, and that's essentially because the two groups can differ in ways other than in the variable under the study. Okay, and then there's two ways to do that. You can, excuse me, you can prospectively look at data, or you can retrospectively. So prospectively, you're following them as they come, or retrospectively, you're looking at past data that has been collected. Okay. Case controlled studies. So case controlled studies are studies, okay, in which patients who already have a specific condition are compared with people who don't have the condition, okay? Generally, researchers are looking to identify factors or exposures that might be associated with the illness that they're looking at, okay? And generally, they will rely on medical records for data collection. Now, again, these types of studies are often less reliable than RCTs and cohort studies, I should say, because even though there may be a statistical relationship that doesn't necessarily mean that one factor necessarily caused the other. Okay? Um, Cross-sectional studies. So, cross-sectional studies describe the relationship between diseases and other factors at one point in a time, um, at one point in time in a defined population. Okay, these studies generally lack information of timing of exposure and outcome relationships, um, and they only include prevalent prevalent cases. Okay, um, most cross sectional studies that you will see will be what's an example? Like diagnostic studies, okay? So those are the studies that you will probably see the most within the time within this class. So get to know them very well because you will see these a lot. Now, determining the type of study that you would use for the question you are researching really depends on what you're asking. So if you're looking at comparing therapies or interventions, then randomized controlled trials would be the way to go. But let's say you're just focusing on diagnostics, then you would probably be more interested in like a cohort study or cross-sectional study. And that's generally because RCTs don't apply. Again, the type of study is dependent on the question you are asking. So let's talk a little bit about validity. Validity is the first thing you will look at, and it's very important. You want to know, was the study conducted so that the results are true for the sample size described? And again, we focus on sample size because it's impossible to look at the exact population. It changes every day. So again, are the results true for the sample size talked about within the article? Then you want to look at bias. Okay? Um, Examples of bias include systematic error that produces bad conclusions, or huge differences between groups that could not be related to chance, like they're just too large. They're not related to chance. Okay, validity is important. This will help you determine if you should essentially continue to use or read the article. If if a study is poorly constructed, generally, they will overemphasize a larger effect than the study intervention really has, okay? So, this is why we focus so much on validity. So, if there's no blinding or you see a lot of loss to follow-ups, this can lead to overestimating the effect of what you are looking at, and that can lead to an invalid conclusion. This is why we look at validity. So an example would be like with randomized controlled trials, if the study is randomized inappropriately, the differences between the groups can be seen, and that difference will be larger than just by chance, which will lead to bias, which we want to reduce the amount of bias.